Women's health, global and regional perspectives on common and vaginal diseases. Women are the backbone of every society. Their physical and mental well-being directly influences not only their own lives, but also the health and prosperity of families and future generations. Globally, women face multiple health challenges ranging from anemia and osteoporosis to diabetes, cardiovascular diseases, and reproductive tract infections. According to the World Health Organization, WHO, 2023, women's health indicators remain unequal across regions, especially between developed and developing countries. This video aims to highlight the common and vaginal health issues among women, with an emphasis on global statistics, regional breakdowns, and comparative analysis between developed and developing nations. Global overview of women's health issues. Anemia. Globally, about 30% of women of reproductive age suffer from anemia, primarily due to iron deficiency. WHO 2023. Symptoms: fatigue, weakness, shortness of breath, pale skin. Prevention: iron-rich diet, supplements, and regular screening. 2. Osteoporosis worldwide. 1 in 3 women over 50 suffers fractures due to osteoporosis. International Osteoporosis Foundation 2022. Causes: vitamin D and calcium deficiency, hormonal changes, sedentary lifestyle. 3. Diabetes and obesity. According to the International Diabetes Federation, IDF 2022, about 16% of women worldwide are affected by diabetes. Obesity among women is rising globally, with the highest rates in the Americas and the Middle East. 4. Cardiovascular diseases, CVDs. CVDs are the leading cause of death among women worldwide, accounting for 35% of female deaths. WHO 2021. Hypertension, stress, poor diet, and lifestyle are major risk factors. 5. Vaginal and reproductive health issues. Vaginal infections. Nearly 40% of women globally experience vaginal infections at some point in life. UNFPA 2022. Urinary tract infections, UTIs. Women are 4 times more likely than men to develop UTIs. CDC 2021. Sexually transmitted infections, STIs. Over 500 million women worldwide live with genital infections like HPV, HSV, or HIV. WHO 2022. Polycystic ovary syndrome, PCOS. Globally, about 10–15% of women are affected. WHO 2023. Regional analysis. 1. Asia, including South Asia and Pakistan. Anemia. South Asia has the highest prevalence with about 52% of women affected. UNICEF 2022. Maternal mortality. South Asia's maternal mortality ratio is 152 per 100,000 live births, higher than global averages. PCOS. Rapidly increasing in urban areas due to lifestyle and obesity. Cultural barriers often prevent women from seeking treatment for vaginal and reproductive issues. 2. Sub-Saharan Africa maternal mortality, the highest in the world, at 545 per 100,000 live births. WHO 2022. HIV/AIDS. Women account for nearly 59% of adults living with HIV in this region. STIs. High prevalence due to lack of awareness, stigma, and limited healthcare access. Anemia. Nearly 48% of women of reproductive age are affected. 3. Latin America and the Caribbean. Obesity. Over 40% of women are overweight or obese. PAHO 2021. Diabetes. Around 13% prevalence among adult women. Cervical cancer. Major health burden, often due to lack of HPV vaccination and late diagnosis. 4. Developed countries, Europe and North America. Maternal mortality. Very low. Around 10–15 per 100,000 live births. Osteoporosis. High prevalence in postmenopausal women, especially in Europe. Cardiovascular disease. The #1 killer among women, despite better healthcare access. STIs. HPV remains a major concern, though vaccination programs are reducing prevalence. Developed versus developing countries. A comparison: maternal mortality 10–15 per 100,000 in developed countries, 150–500 per 100,000 in developing countries. Anemia in women, 15–20% in developed countries, 40–60% in developing countries. Osteoporosis, high in elderly women in developed countries, often undiagnosed in developing countries. STIs and vaginal health, better screening and HPV vaccination in developed countries, high prevalence and low awareness in developing countries. Healthcare access, universal coverage in most developed regions, limited access, especially rural areas, in developing countries. Lifestyle diseases, obesity, heart disease, and mental health in developed countries. Infectious diseases plus lifestyle diseases together in developing countries. Preventive measures and global recommendations. 1. Balanced nutrition. Ensure iron, calcium, and vitamin-rich diets. 2. Vaccinations, HPV vaccination to prevent cervical cancer. 3. Hygiene and awareness. Promote menstrual and reproductive hygiene education. 4. Regular screening, anemia tests, pap smears, mammograms, and STI testing. 5. Policy measures. Governments and NGOs should expand women's health programs with special focus on reproductive health in developing regions. Women's health is not just a personal issue, it is a global development priority. While developed countries face challenges with lifestyle diseases like obesity and heart disease, developing regions continue to struggle with maternal mortality, anemia, and untreated vaginal reproductive infections. Bridging this gap requires global solidarity, targeted awareness campaigns, and equitable healthcare access. Empowering women with better health ultimately empowers entire nations. References 1. World Health Organization, WHO, Global Health Observatory 2023-2, International Diabetes Federation, IDF, Diabetes Atlas 2022-3, International Osteoporosis Foundation 2022-4, UNICEF, Women's Health and Nutrition Report 2022-5, UNFPA, State of World Population Report 2022-6, CDC Global Health Data 2021-7, PAHO, Women's Health in the Americas 2021-8, World Bank, Global Maternal Health Data 2023. Thank you, watching Pakistan Pulse.